Hi everyone. In this video, I will talk about our pregnancy journey. As some of you may know, my wife is about 32 weeks pregnant. We are very blessed and thankful that we're having a boy and that everything is going well so far. However, not everyone is as lucky as us in getting pregnant. And so in this video, I will ask my wife, who is a labor and delivery nurse, how and what she used to get pregnant. So with that being said, let's start today's video. Thank you for clicking on this video. If you like learning about nursing, consider subscribing down below. I upload at least one new video every week. I would also appreciate it if you give the video a thumbs up, as I use this information to identify which videos most people liked and make similar topics about them. So the best way I think to do this is if I ask my wife a bunch of questions and she provides her advice. Now keep in mind that this is not bulletproof and that this is her anecdotal evidence. This is what we did and it may not necessarily work for you. So the menstrual cycle is 28 days long. At the end of that time, there's either a pregnancy or a period. The three main organs that are involved in the menstrual cycle are the brain through the hypothalamus and pituitary glands, the ovaries, and the uterus, or formerly known as the endometrium. So on day 1, the pituitary gland releases FSH and LH, which stimulate follicles in the ovaries to mature. Each follicle contains one egg. As follicles mature, they release estrogen. The estrogen eventually reaches a peak, which triggers ovulation. Ovulation occurs when the most mature egg bursts outside of its follicle and starts traveling toward the uterus through the fallopian tube. When ovulation occurs, it causes the brain to decrease FSH and LH production. So now the empty follicle turns into the corpus luteum and secretes progesterone. Progesterone stimulates the uterine lining to bring in blood and nutrients to prepare for implantation to occur. This means that the egg is ready to be fertilized around the 14th day because it is traveling down the fallopian tube and ready to be implanted by the sperm cell. If the egg gets fertilized, then it implants after about 68 days. If the egg does not get fertilized, then progesterone and estrogen levels drop, and eventually blood, tissue, and the egg is shed and leaves the body. So my wife will be talking about LH, which is luteinizing hormone, which essentially is measured by the strip and tells us if she has a high level of LH circulating, meaning that the mature egg is most likely leaving the follicle, which ultimately indicates a high level of success rate for fertilization. At least that's the theory behind it.
Hello again, everyone. I'll just repeat the disclaimer that Sep said before about the fact that this is what worked for us. This does not mean it's going to work for everybody. It might not even work for most people. This just worked for us and patterns that I have heard from patients working in labor and delivery that seem consistently to be helpful. We will start a little bit just with what goes on in the menstrual cycle for women. So this is all based off a 28-day cycle, which is average. This doesn't mean you're abnormal if you're on either end of this. Anything from kind of a 23 to 35 day cycle is normal, but I'm basing this off of a typical 28-day cycle. So in a 28-day cycle, day 1 is the first day of your period. So let's just say that lasts 5 days. Day 14 is halfway through your cycle. Day 14 is when you ovulate, and then day 28 is the last day of your cycle before your period starts again. So that's kind of what I'll be basing this off of. So the idea is you're looking to get pregnant in your fertility window. That usually is about a 4 to 5 day window, and people wonder, well, isn't there just 1 day a month that I ovulate? How can I be fertile on days other than that? The idea is that sperm can actually live in the female body for up to 4 days at a time. So if you and your partner we'll just use words that isn't going to demonetize this video. Let's just say if you and your partner are trying for, up to 4 days before you actually ovulate, it is possible that the sperm can live in the woman's body up until the day she ovulates and still properly become fertilized. So one way that you can increase your chances is to try on 4 days leading up to that ovulation date and 1 day after, as ovulation can last up to 24 hours. So that's sort of what we did. So I also recommend using or making a little chart kind of like this. This is what I did. Hopefully you can see there. So for me, this was in August. So I started the month, my period started on day 1 of August. You can see starting over here, and then 2 through 5 there. And so for me, it happened to fall that in the month of August, day 1 of my cycle was day 1 of my period, and August 1st. So that's kind of what we're going off of. So for me, my period lasted days 1 through 5. And then I began taking ovulation strips. Everyone has a different way that they want to go about this. I am just super impatient, so I wanted to maximize my chances the first time around. However, it makes also lots of sense to me that people want to make it a little more organic and not feel like they're trying and calculating and doing the math right from the start. So you may choose to kind of let things happen as they may for the first few months while you're trying. But for us, I did want to know when I was ovulating. So before this process leading up to August, for about 3 months, I was tracking how long my cycles were. So I was tracking the day 1 of the first day of my period all the way to day 1 of the next period that I had. So then I was able to average about how long my cycles were. And mine were kind of around the 23 to 29 day mark. So I based this chart off of a typical 28 day cycle, as I said. So these ovulation strip kits, you can buy on Amazon, you can buy them at Shoppers, you can buy them anywhere, and there's a huge range in price. There's digital ones, there's normal just pea stick ones. We use the dollar store ones and it worked for us, so I'm not saying once again that will work for everyone, but for me, I did get an accurate reading based off the dollar store strip, so I can show you guys what that looked like. But this was just to track, when I say track ovulation, I'm saying specifically these strips will help you track when you get the spike in luteinizing hormone in your cycle. So your luteinizing hormone kind of is like this, like this, like this, and then about 24 hours before you're supposed to ovulate, you'll have a huge spike. And when you dip this each day, this strip will detect that huge spike, meaning that in the next 24 hours following, that's most likely when you're going to be ovulating. So these, I'll show you a picture. I'm just looking down at my iPad. That's what I'm looking at. So you can see the line here, there is a line that says T and then a line that says C. So T is your test line, that's the control line. Unlike a pregnancy test, anything in the T line there doesn't mean that it's a positive. It will almost always have something there. It is only a positive ovulation strip if the T is as strong or stronger than the C line. So you can see this is just a random day in my cycle where that spike wasn't happening. And over here in the next photo, that is the day that it was a true, can you see? Oh yeah, a true positive. So you can see that the test line is actually a bit darker than the control line there. And for me, that fell on day 16 of my cycle, so August 16th. So that being said, we had been trying for about 3 days leading up to that date. And then we also did 1 more day afterwards just to make sure that we were encompassing that full window. And for us, it did work based on this test. So I would recommend before you go and spend up to like $20 for one test, just try the dollar store. You may have some luck. And then that being said, so I'm just going back to my chart here. I just started charting on the day that I got the positive OPK down there. That just stands for Ovulation Predictor Kit. So that was the first day that I got that. And I marked each day DPO, meaning days past ovulation. So I started 1 DPO, 2 DPO, 3 DPO. And I just began writing down my symptoms. You're gonna imagine the symptoms. You're gonna just suddenly think that like because your nostrils itchy that day that you have a magical symptom. But I just wrote anything that felt a little bit out of the ordinary, which for me, you know, a sore chest or a random breakout when it didn't normally happen, a little bit of nausea. So I wrote that each day just for fun. I did not think this was gonna happen the first try around, so it was nice just to kind of track symptoms if it hadn't happened. And then you get to know your body a little bit more. And then you can see over here, hold on, over, where did I put it? Oh, at 11 DPO there. I said it just seemed to be maybe a faintly positive. So actually, according to what I've read, day 12 is the most common date to get your first positive pregnancy test. Though you really can, I have found people that have gotten one positive as early as 6 DPO. So don't be a crazy person like me and test 6 days DPO. That's very unusual. Good for those people. Then they wouldn't have gone as insane as I did. I took like 50. Legitimately 50. But you really shouldn't. They actually really say not even to start testing until the day that you were supposed to miss your next period. But I was testing every day, so maybe this is just information for you guys. So like I said, I got a potentially positive on the evening of 11 DPO. Most normal human beings probably couldn't have even seen the line that I saw, but I saw it. I'm telling you I saw it, because the next day when I woke up and I took the test, it was an obvious positive on 12 DPO. And that is actually apparently the most common day to get your first positive. So that's kind of how it all worked for me. In terms of tips and tricks, these are not backed by science, okay? As I said, these are just sort of patterns that I've heard from talking to patients and some speculation amongst the medical team that I work with. But things that I would recommend is that we know that stress levels can impact fertility. So just try and stick with your normal lifestyle. Do things that make you happy and keep your cortisol and stress levels down. So for me, I was regularly exercising every day. We still saw friends. I didn't suddenly stop drinking coffee. I didn't suddenly stop drinking alcohol. We went out, and went on a trip a few weeks beforehand, and I just partied as I normally would. And so because of this, I think nothing was out of balance for my body. I was just functioning as usual. So I would say just keep yourself happy, be in the zen, do things to de-stress every day. Also, I would say after each time that we tried, I religiously kept my legs up. You hear this all the time. I'm sure it probably doesn't contribute that much, but it can only help gravitationally to try and keep your legs up and in the air for about 15 to 20 minutes after each time, in hopes that you're increasing sperm's ability to move upwards through the reproductive tract of the woman. What are other tips could I say? I would also just say, even though it did happen to work for us the first time, do not stress yourself out if it doesn't work for you the first time. As I said, it can take months to just even get to know your body. You may think that just because you ovulated on day 14, exactly 1 month, that every time it's going to be like that. But it may be that it's 7 days later the next time around. So just take some time to get to know yourself. Don't have any expectations. The vast majority of couples will get pregnant in the first 6 months of trying. And so any time within that time frame, even up to a year, is still considered normal. So that's what I would say.
And so the next question would be, now that you are pregnant, and it has been quite a bit, you're more than 30 weeks now into it, how have you felt? Have you had any abnormal symptoms? And have you received any medication or any tips and tricks for alleviating those symptoms?
Me personally, as uncomfortable as I have been, as Sep also said earlier, I've had a normal pregnancy in terms of that I haven't had any really complications. I wasn't that sick. I had morning sickness for about a month or so. I had back pain for a short period of time, like all things that fall within the normal. And every woman is so different in how they experience pregnancy. But I would say I felt the worst in the first, sort of for me, weeks 6 to 10 of pregnancy was exactly the month that I was nauseous, and I was really nauseous. But a lot of people's nausea kind of follows a pattern. Like you do get a little bit of relief at certain times of day, and you'll find out what those are for you. And some people just unfortunately don't get much relief. They say that most morning sickness should be pretty much over by the end of the first trimester. So I was lucky enough that happened for me. If that hadn't happened for you, there are medications you can take. So look into that. It's not normal to be suffering and vomiting to the point of dehydration for weeks on end. So get help if that's what's happening to you. Vomiting each morning in the beginning of pregnancy is normal though. Medication-wise, I did end up taking an anti-nausea medication only for about a week, and I personally didn't find that it made too much difference. But for some people it works great. And then in terms of other symptoms, it was just, a very sore chest for way longer than I would have expected. That actually lasted until about 20 weeks. Most of my symptoms, though, did fall in the range of normal. I started producing, as they call, colostrum, or your first little milk supply started coming in around week 14 for me, so that was weird, but still normal. I've had lately, in the last 2 weeks or so, like acne, like I'm a teenager again. That's been really weird for me. My hair has started like really breaking. You can see up here that I hear about, you always hear about baby hairs in pregnancy. Some women, their hair becomes more voluptuous. Some women, their hair starts falling out. Of course, mine started falling out. So that's just life for me, of course. But yeah, you'd be given other medications if other things started not to go wrong, but go off the path of normal, such as gestational diabetes. You may end up on insulin, or if you have something called Group B strep, which wouldn't be detected until later in pregnancy, they would just probably give you antibiotics during labor. It just depends on your unique situation. As I said, everybody is so different. But for me, I have been okay. I probably felt the best kind of probably weeks 14 to 20, and then kind of 20 weeks onward for me, I've had a variety of just aches and pains, as you do, but I have a very short torso, so I find I'm very breathless, and my digestion is just poor because of the baby taking up so much space. But you know, it's temporary. It's okay.
You talked a lot about, earlier you talked about stress levels, and given the whole pregnancy, you alleviated a lot of your stress by exercising a lot. And has that been a huge impact on your mental fatigue? Like, I know that you obviously like to exercise and run and stuff like that, but you can't now because of the pregnancy. And how have you coped with that, or have you, and what have you done to kind of help you with that sort of thing?
They say in pregnancy, as much as you can, just to try and keep your body within the range of what you were doing before, and that's what's safe. So if you were someone who was an avid runner before pregnancy, don't worry to continue running if you feel up for it. That is safe for the baby as long as that was what you were doing before. Don't start a new running regime while you're being pregnant. But for me, I was running quite religiously right up until getting pregnant, and within a couple weeks of finding out I was pregnant, I could no longer do it just because I was so out of breath. And so for me, I think that sudden shift in an active lifestyle was really hard. I actually think that's probably been the hardest part of pregnancy for me. Was just, I'm used to someone that's moving around all the time and on the go. And just because of all the little minor symptoms that are just a nuisance, I've not been able to do that. So I have done really no cardio since getting pregnant, which is the first time that I remember going so long without doing any vigorous exercise since I was like a young teenager. So that's been hard mentally, but I think it's all about just finding something that can give you even some peace of mind, or something to replace it that, can just do something for your mental health. So for me, it's just been finally accepting the point that I am not going to be able to just go for a run, and deciding instead that the goal is going to be 10,000 steps a day for me. So my husband and I will go for frequent longer walks until I'm uncomfortable. Walking for an hour a day, if that's all you can do, that is something. It's just good to lubricate your joints and be moving, and don't use pregnancy as an excuse to just be completely sedentary unless you're on bed rest because your doctor told you to do so. But overall, it's beneficial for you to keep active. And I would say the walking is what has kept my mood probably as good as it's been. I've been relatively stable. Hopefully my husband would agree.
Yes. And talking about stability, one of the great, I'm sure many people are wondering, what has been your cravings? Have you had any cravings? Obviously I know them, but it'd be a fun last question to ask you.
Cravings. Okay, I've been a vegetarian since I was I guess since high school, really. So many years now. And I can tell you that the craving, and I know it was a true pregnancy craving because, as I said, I don't like meat. I don't want to eat meat. I haven't eaten meat in a very long time, but one day, I cannot tell you the overwhelming desire that I had for a turkey sandwich. I had to have it. It was like a fixation, and it lasted days. Like, I couldn't stop thinking about it till I had to have it. And then I had it, and then I was okay. But that's really the only really weird pregnancy craving that I've had. I should say, people, if you are craving things like ice all the time, if you're craving, like, you're looking at some chalk or like a rock or anything like that and you want to eat it, go get your iron levels checked, please. This is not normal. That's usually a sign and symptom of low iron. Which my iron has been low, but I haven't eaten any rocks yet, thank the Lord. But yeah, just keep on top of that. And you know, if you're craving something, even if it's not healthy, just moderation is okay. Just let yourself have it, okay? You have a good excuse.
Okay, well, thank you so much for sharing your experience, and I hope the viewers have found it useful. I know they will. And thank you so much for your time and everything like that. And if you guys enjoyed it, let me know in the comments down below, and I will catch you in the next video. Thanks for watching.
Thanks for watching, everyone. And if there's any specific questions that anyone has about any parts of this, or kind of the diagram that I was talking about at the beginning, let me know, and I can maybe get Sep to post like a template of the one that I used if anyone has any further questions.